So in the last lecture we studied about the very important characteristic of the arterial and the venous vessels, and that was the stretchability. And two definitions were discussed. One was the distensibility, which is the fractional increase in the volume of the vessel with a unit increase in the pressure. Then there was compliance, which is the increase in volume, overall increase in volume with a unit increase or decrease in pressure, and they are related with the equation that compliance is equal to distensibility multiplied by the volume. Then there was another which is that this stress compliance is that the vessels try to mitigate any change in pressure by changing the caliber of the vessels. That means they try to minimize any pressure that develops inside the vessels. Now today we are going to discuss the normal and abnormal pressure pulse contours. Now first the normal contour. In the normal contour, whenever a pulse travels in the vessel, it causes the distension of the arteries, and this is of course palpated in the form of a pulse. Now in this pulse there are two actually limb. One is called as the first there is a sharp rise in the pressure from the baseline of 80 millimeter of mercury, and this is called as the anacrotic limb. This corresponds to the rapid ejection phase of the cardiac cycle, and then there is a slow increase in pressure to its peak value, which is about 120 millimeter in normal person. Then the second part of this normal contour is that of the descending limb, and the first part of the descending limb is when the blood keeps on moving onward in the arteries despite although there is no entry of blood from behind from the left ventricle. Now this descending limb is interrupted by another very interesting process which is called as the incisura, and this happens because of the closure of the aortic valve, because when the aortic valve closes at the end of the systolic period, then what happens is that the blood tries to come back towards the left ventricle. This backward slight duration of backward flow will cause a slight increase or interruption in the pressure, and this is called as the incisura. Then eventually there is a slow decline, and then the pressure returns back to its baseline value, and which is in this case normal is about 80 millimeter of mercury. And this is the normal contour. You can see first there is a steep rise in the pressure here in the systolic period, and then there is a rather slow increase in pressure, and then it is about almost equal to 120 millimeter, and then there is a decline in the pressure, and this is the incisura where the aortic valve closes, and then there is a gradual fall in the blood pressure back towards the diastolic pressure. Now there are abnormal pressure contours. Now these abnormal pressure contours are seen in certain diseases, and about 4 diseases are actually discussed here. One is the aortic stenosis or aortic valve stenosis, in which the aortic valve becomes so narrow that the blood is passing with difficulty through this valve from the left ventricle into the aorta. So in this case the aortic pressure pulse is decreased because now the flow through this valve is very sluggish, very slow. Then is the patent ductus arteriosus. This is a condition in which a channel remains open from the aorta into the pulmonary artery, which was present in the intrauterine life, but usually after the birth of the baby within 2 or 3 weeks this channel is closed, but in some people this channel remains open, and this will cause the leakage of blood from the aorta into the pulmonary artery. So in this case, the systolic blood pressure is very high because now the left ventricle has to contract very forcefully to push the blood to the circulatory whole of the circulatory tree, and the diastolic pressure falls very low because now during diastolic period the blood from the aorta leaks into the pulmonary artery through this patent ductus arteriosus. Then the third condition is the aortic regurgitation. In aortic regurgitation, the aortic valve is not closed properly during the diastolic period, so the systolic pressure is very high because again the left ventricle has to contract very forcefully to supply the blood to whole of the body, because what happens is that during diastolic period a fair amount of blood which has gone into the aorta, which has been pushed into the aorta, that again regurgitates back or returns back to the left ventricle because of the improper closure of the aortic valve. So the systolic pressure is very high, whereas the diastolic pressure almost falls to zero. And then important thing is that there is no incisura, because incisura is because of the closure of the valve, aortic valve. So since aortic valve is not closed properly, so there will be no incisura in this case. In arteriosclerosis, which is a disease in which with old age the vessels become hard, so systolic pressure is high because of less expansibility or distensibility of the vessels, and then diastolic pressure is also very high because of the less compliance of these vessels. These are the diagram showing the abnormal pressure contours. You can see here normal contour is the pressure wave from 80 millimeter to 120 millimeter with the presence of this incisura. In arteriosclerosis, because of the hardening of the vessel, the systolic pressure becomes very high. You can see in this case it is more than 160 millimeter of mercury, and then the diastolic pressure is here, it is shown 80, but it may be more than 80. And aortic stenosis, because of the stenosis or narrowing of the valve, the systolic pressure is not as high as a normal person. So the pressure may in this case be less than 100 or 110 millimeter of mercury, whereas the diastolic pressure is the same as 80 millimeter of mercury. Now in patent ductus arteriosus, the systolic pressure goes very high, again it is about 180 millimeter of mercury, whereas the diastolic pressure falls very low, it may be less than 40 millimeter of mercury. So you can see here the systolic pressure is 160 and the diastolic pressure is about 30 or 35 millimeter of mercury. In aortic regurgitation, the systolic pressure is again very high, and then there is no incisura here because of improper closure of the aortic valve, and then the diastolic pressure again falls very low. Now, as I told you earlier, when the left ventricle contracts, the pulse moves in the form of an expansion of the artery. So this expansion is, or the pulsation is then dampened by the time this pulse reaches at the level of the capillaries. So this dampening of the pressure pulse is because of three reasons. One is because of the resistance of the blood movement in vessels. We have already seen that the smaller vessel, the arterioles, metaarterioles and precapillary sphincters, they offer resistance to flow. They actually resist the flow of blood from the arterial side to the capillaries. So this will cause the damping of the pressure pulse. The second reason of this is the compliance of the vessels. That means whenever the blood comes into the arterial system, there is expansion of the vessels or the arteries. So this expansion will try to decrease the intensity of pulse. So this is compliance of the vessels. Third is the viscosity of blood. As I told you that the blood has got about 3 times the viscosity of blood flow. So this resistance to flow of blood in the arterial system will again cause damping of the pressure pulse. So this damping of the pressure pulse is directly proportional to the product of resistance multiplied by the compliance. Now, the velocity of pressure pulse in different parts of this arterial system is different. For example, it is 3 to 5 meters per second in the aorta and 7 to 10 meters per second in the large arteries and about 15 to 35 meters per second in the smaller arteries. So in the smaller arteries, the blood is flowing at a very rapid rate. So this is how the dampening occurs. You can see in the proximal aorta, this is the formation of pulse wave. You can see here it is very high, then low, then again very high, and then in caesura. And in the femoral artery, you can see this again, this pattern is seen. But in the radial artery, you can see there is damping of this pulse wave, and you can see a relatively slight increase during the systolic blood pressure. And then in the arterioles, this is further dampened, and then in the capillaries it is almost a straight line. That means now the blood is flowing in the form of a continuous flow. Now arterial blood pressure is the pressure that is exerted by the blood against the unit area of blood vessel wall. Its units are millimeter of mercury if the pressure is high, or if for low pressure the units are centimeter of water. And the conversion formula is that 1 millimeter mercury is equal to 1.36 centimeter of water. Now this blood pressure is clinically measured by listening to the special sounds which are called as Korotkoff sounds, and these sounds are produced because of the jetting of blood and then the vibration of blood vessels, and these two effects will produce the turbulence in blood flow. Now this arterial blood pressure is composed of two components. One is the systolic component, in which a tapping sound is heard which gradually becomes harsher, and then is the diastolic pressure, in which the sounds are muffled. Muffled means their intensity is low, or in Urdu we can say daba hua ya awaz. Now pulse pressure is the difference of the two. Here you can see how we can record the blood pressure. You can see cuff pressure is inflated up to this about 130 or 140 millimeter mercury, and then we keep on decreasing the pressure, and here is the first sound heard, which is louder tapping sound, and this is the systolic pressure. Again we keep on decreasing the pressure here, and the sound becomes louder, and then we again keep on decreasing the sound, and here the sound becomes softer, and this is the point where the sounds become muffled or they are hardly audible, and this is the point which is the diastolic pressure of that person. Now there are two methods of determining of the blood pressure. One is the direct method, in which we inject a cannula into the artery of a person and then attach it to some pressure measuring device, and then we can determine the blood pressure. It is the most accurate method of determination of blood pressure. The indirect method is the auscultative method, in which we apply a cuff around the arm of the person, and then the pressure in the cuff is decreased gradually, and we can then hear the sounds we have already mentioned. Mean